This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Amy Abernethy, President of the American Academy of Hospice and Palliative Medicine. Dr. Abernethy also leads ASCO's Virtual Learning Collaborative for Palliative Care, and she is the Associate Professor of Medicine and Director of Duke University's Center for Learning Healthcare. Welcome, Dr. Abernethy.
Thank you.
We hear very often how palliative care both is a cost savings and its benefit in extending life. Mm-hmm. How does it accomplish those two things?
In the context of cost savings, part of it is that by helping to identify what does this person need today, identifying the goals of care and also having the communication skills that allows us to do that, oftentimes what ends up happening is that we hone in on the care that this particular person wants and reduce a lot of excessive, unnecessary, whether that is different types of chemotherapy and anti-cancer treatments, or it actually may be making sure that we're focusing on keeping the patient in the home and trying to keep them out of the hospital or other things that frequently bring cost into the system. So frequently, it's the communication and goal setting, which isn't necessarily about reducing availability and access to treatments, but really just getting the right treatments for this patient today that ultimately reduces costs and better aligns care. Now, you asked a second question there, and your second question was, how might palliative medicine or palliative care extend survival? We've got data to suggest that it does, but it sort of often makes you scratch your head. If you're reducing costs and reducing contact or availability of specific treatments, how is that going to relate to improved survival? Well, a few things. So first of all, if we better focus on symptom control, quality of life, and what this person needs, often that ultimately translates to identifying and targeting the right treatments, but not having treatments that increase toxicities that also bring both cost into the system, but also may have negative impact in terms of length of life. Also, it makes good sense that when your sense of purpose, your sense of meaning in life, and your ability to interact with your family and the people that you love is heightened, longevity tends to lengthen, because longevity is more than just what the disease and the tumor is doing. It's actually really the whole personhood and the whole milieu. So some of it is reduction in unnecessary and toxic treatments, and some of it is probably got to do with the extension of the focus on quality of life and what that ultimately does to personhood.
Explain more about value in cancer care.
Value is a combination of reflection that ultimately we want to make sure that we've got highest quality care and that we're not overpaying for what it is that we ultimately having provided to us within the context of the care that we need, and that we're not receiving too much health care. We're essentially right-sizing it. So part of value is figuring out how do we right-size healthcare. Part of value is making sure that the tools that we're putting in place for the care of this particular patient is both the most effective tool, but also the most cost-effective tool. It is, you wouldn't buy a house 20 times too big just because you want the house. You want the house that's the right house for you and your family, and the same thing for you and your healthcare. And the final thing about value is a societal conversation. We need to have the conversation of how do we ultimately identify the portfolio of skills and solutions we want to make sure that we've got best health care, and not keep running forward with particular medicines or particular radiology techniques because we haven't had the conversation of how we identify the ones that are most valuable today.
Thank you, Dr. Amy Abernethy, President of the American Academy of Hospice and Palliative Medicine. Dr. Abernethy also leads ASCO's Virtual Learning Collaborative for Palliative Care, Associate Professor of Medicine and Director of Duke University's Center for Learning Healthcare. Thank you very much.
Thank you.